Thank you for joining this session. This session is Engaging Community Voices at Scale, where we're going to be talking to three folks based in the community from the Hunger Project, Landesa, and VillageReach, who are innovating to amplify and empower community voices to drive social change. And so we're very happy to have this. I don't know if folks were able to be in the earlier session that focused on increasing resiliency through locally led development, but great session. And it really focused on empowering leaders who are deeply connected to their communities. In this session, they did touch on community voices and how to incorporate community voices. In this session, we're really going to put a spotlight on that. How are community voices being incorporated, not just being incorporated in what you do, but are actual drivers? How is the community the actual driver in creating and sustaining solutions at the local level? So with that, I would like to welcome our panelists. Bios are in Whova, of course, so you can click on that and see it. You'll have to excuse us. Esther's doing a switch, so she will join us in a second, but we'll go on, and when she appears, she'll magically appears, and we'll back up and introduce Esther. So what I'd like to do is a quick lightning round with Roberto and Freddy to kind of say hi, who they are, and what communities they're currently working in. Thank you. Roberto, you want to go first?
Yeah, for sure. Thank you, Jane. So, hi, everyone. I'm super excited to be here. Thank you, Goalmakers and Global Washingtons for the invitation to the Hunger Project Mexico. I am Roberto. I am a strategic and advocacy director of the Hunger Project Mexico. So we are working with the rural and indigenous people, specifically with women, indigenous women around the country. Specific in states where they're living in poverty and extreme poverty. So thank you, Jane, for the invitation.
Thanks, Roberto. Freddy.
Okay, thanks, Jane. Hi, everyone. My name is Freddy Nkosi. I'm the Senior Director within the Global Programs at VillageReach, responsible for the West and Central African region. But currently, I'm acting as the Vice President for Partnership and Impact at VillageReach. I'm currently based in Kinshasa, the capital city of the Democratic Republic of Congo. For those who don't know about VillageReach, VillageReach works with governments, the private sector, partners, and communities to build responsive primary healthcare systems that deliver health products, information, and services to Africa's most underreached community. So thank you.
Wonderful. Thank you. Thank you very much. So we'll kick off. And again, once Esther's able to join, we'll go back and say hi to her. So I guess one of the first questions we want to talk about is, what are the key elements of bringing community voices into your work and incorporating in your work? In what ways that communities, in ways that communities can actually drive the solutions and how they're designed and how they're implemented? Oh, wait. Esther, is that you?
Yes.
This is me. Thank you.
Great. Is she spotlighted? I know she's named Alex right now. There you go. That's not Alex. Her name's Esther. Esther. Alex is our host, so that everybody shows up as Alex. Esther, welcome. There you go. Really quick, I'd love for you to just say hi. Where are you and the communities that you are working in?
Thank you very much. My name is Esther Mwaura-Muiru. I come from Kenya and I work from Nairobi, Kenya. And I work for the Stand for Halal campaign, which is a global initiative to close the gap between the very beautiful laws and policies we have to advance land rights and the reality of the women on the ground, which is horrible. So we try to close the gap and making sure that implementation happen, but also thinking that, we are convinced laws alone do not serve anyone. that there's so many social norms and practices that are barriers. So we are also crashing the negative social norms and barriers and practices that that really make it hard for women to access, control, and own land. But right now, I am in Riyadh, in Saudi Arabia, where we have the Conference on Parties on United Nations to combat desertification. So that's where I am.
Brilliant.
And I'm very pleased to be here.
Thank you, Esther. I'm glad you could make it, even though you're in transit and far away from your home. So we're just going to kick it off. And this is a question for all three of you to respond to, is to talk about what are the key elements of bringing community voices into your work? What are the ways that communities drive how solutions are designed and implemented? So from the beginning to the middle to the end and ongoing, what are those key elements to making sure community voices are the center of the mix? Who would like to take that one?
I can go first.
Great.
Yeah, I can go first. Yeah, so some of those key elements will include, first and foremost, placing the underreached communities at the center. You probably heard about the saying, nothing about us without us. So we don't speak on behalf of the community, and we should not speak on behalf of the community, because the community can speak for themselves, but we can amplify their voices. So the first element is placing the community at the center of any intervention. So they should be involved in all the process, from the inception phase, implementation, evaluation, and so on. So the second element, after you set up the scene of placing the community at the center, the second element, you need to codify actionable primary health care needs and preference metrics with government and these communities. And I'm talking about the health sectors. Then the third element, after codifying those actionable primary health care needs and preference metrics, you need now to aggregate insight from the community, not only the communities, but also the health workers through diverse and routine channels, depending on the community. Some communities, they can use technology means. Others, they may use even community consultations. And I've seen in some places in the rural areas where they put boxes where community can drop their needs and their suggestions. That can be also collected. Then fourthly, you need, or we need to work with the government and technology partners by bringing all the data together in one centralized location, so that decision makers can easily see where there are gaps and opportunities. So after collecting those voices, needs, and preferences, you need to bring them together in one centralized places and to see gaps and opportunities. And the next element, the next key element is the implementation. So after collecting the voices, you centralize, you need to implement those actions and monitor their impact together with the community. Then finally, it's about closing the loop and communicating the results of the intervention back to the underreached communities. Communicating back the results is a very important step, because most of the time the community, they complain. People came, they collect our voices, but we don't know what's next, what's happened. So we need to go back to the community to tell them, look, with you, together with you, we collected voices, we analyzed them, we we identify gaps and opportunities, we implement actions. This is the result, and where do we see we can make changes? So maybe I can stop there to give other panelists the opportunity to chime in.
May I have Jen?
Roberto. Yes, please go ahead.
Well, thank you, Jen, and thank you, Freddy, for sharing your experience and vision. It's a super honor to me to share this panel with powerful leadership, as all of you. So I forgot to say that I'm based in the beautiful Mexico City. So welcome everyone. So first, as I said, in a few minutes, I want to say thank you again, Goalmakers, for providing to the Hunger Project Mexico this space to share a little about what our partners are doing, how they are transforming their communities by scaling their visions, promoting participation, and building alliance with governments and local authorities. So I'm thinking in one data about our region. The Inter-American Development Bank say that 1 in 5 people living in Latin America and the Caribbean is classified as living in poverty. So we are the most region that we have a most inequality around the world. So in the current context of increasing inequalities and increasing social political tensions in Latin America and the Caribbean, effective democratic governance become critical to guide the construction of an improved new normal, one that is more inclusive and attentive to citizens' demands for distribute justice, social cohesion, and the expansion of opportunity as required by international commitments and agreements such as the 2030 Agenda, the Escazú Agreement, the Beijing Platform for Action, among others. The Hunger Project is a global movement creating a world without hunger and poverty. We believe that with communities leading, we can tackle the root causes of hunger together. Poverty, gender inequality, conflict, and climate change are the global changes we must address. We envision that thriving planet where everyone has enough to eat, regardless of where they were born or their gender. At THP, specific at the Hunger Project Mexico, we don't speak of beneficiaries, those impact or those reached. Instead, we recognize the people we work with as our partners because they contribute their experience, resources, natural assets, and local talents. While we at the Hunger Project Mexico provided additional resources, methodologies, expertise, financial investment, and support. Together, these elements translate in thematic projects focused on gender, food security, digital inclusion, economic autonomy, democracy, and participation, among others, all aimed at helping communities achieve their visions of sustainable ending hunger, malnutrition, poverty, or inequalities. To delve into the question, I will highlight 3 main elements. So first of all, accompanying people's leadership, particularly indigenous women, to move from resignation to recognizing themselves as agents of change. At the Hunger Project Mexico, we believe that the first steps in advancing our mission, it is a shift in mindset. We achieve them through our methodology, not only implemented in Mexico, but also globally called vision, commitment, and action, something like that, like VC8. These tools places communities and our partners are the center enabling theme to envision their communities towards self-reliance. The second key element is strengthening and contributing to the organizational processes that already exist in communities. We do this by building capacities, particularly with already organized groups such as collective networks or grassroots organizations that have undergone and processed of politicization and transformed their needs into collective demands to engage with local authorities. And the last point, the third point, I'm thinking in building relation with the local government to strengthen democracy and local governance. Despite the severe institutional crisis in our region, the Hunger Project Mexico continues to believe that the most effective way to address inequality is by working with local governments. We do this by nation's capacities, particularly those of women leaders currently holding key decision-making roles at the local or national level within the government. So I'm thinking in some these points that we are working in the Hunger Project Mexico.
Thank you, Roberto. Esther, what are the key elements for you in centering community?
I can just underline all what Roberto and Freddy said, but just to talk about what hasn't worked in the past. Why is it that we may be asking ourselves what are the key elements? And I think for too long that we have assumed for women to have their voice and agency, that they can do it from a voluntary perspective. So putting resources in the hearts of the women who are living in poverty and the margin of development, regardless of which issue they are tackling, and making sure we do not assume that it takes free activities for women to organize themselves, but actually putting resources in the hands of the women to organize as a collective is important, so that they are not speaking from individual perspective, but they are talking from a collective perspective. The second thing is making sure when we are talking about partnership, and I think Roberto said it very, very well, is appreciating that when we're talking about partnership, that the voice and the agency of women is at the center of what we do, not as recipients of the projects and the activities that we are investing in, but people with capacity, knowledge, and they're bringing their whole being to come and contribute. So really recognizing the contribution, accounting for it, and investing in that contribution. And the third thing is ensuring that everything that we do, the data that the women are collecting, it is not for us to use that data, but to support first and foremost the women to be able to collect that data, analyze that data, store that data for themselves, and use it for advocacy. And the fourth thing is ensuring we are not fragmenting the issues that really are confronting the women. And that's why sometimes, even if I have done a lot of many other things, I've been in, I was part of the HIV and AIDS global work. I've done a lot of biodiversity. I've done a lot of working with the women in the slum areas. I realized one big thread that connects people living in poverty is control and ownership of immovable resources. And this is land. Buildings sit on land, roads sits on land. We eat from food that is grown on land. We live on water that is on water and on land. And women, in our data and in our experience, it's shown us that women who are able to control their own land, they are also able to control their own income. They have they are able to control power dynamics at the household. So the issues of gender-based violence is controlled. They are able to negotiate with the government because they can say, here I'm called Esther because I have identity of this physical space where I belong to, and therefore I can speak from that strength. So looking at the things that are really foundational to changing the gender inequality and advancing sustainable development, things like securing women's land rights is so necessary to know where we'll get the multiplier effect.
Wonderful, thank you. There's a couple great questions coming in, and they dovetail with some of the questions that I've teed up. And Freddy, maybe we can touch on this one. Is one of the questions in the chat is placing the community at the center. How do you choose the people who speak for the community? Do you tap local leadership structures? Do you create new leadership structures? How do you do that? And Freddy, maybe you can expand a little bit on your answer on that.
Yeah, that's a great question. In each community, or in most of the communities, you will identify existing community structures. It could be women association or youth association or farmers association or fishermen or traders and so on. Those structures exist. The reason why, when we talk, for instance, about community health workers, the community health workers are chosen within their communities by their peers through those existing structures. So placing the underreach at the center is also tapping into those existing communities without necessarily creating new structures, because those existing communities are already anchored in the communities. They have been created for a specific reasons, and it is easy to work with them, leverage their existence, leverage their know-how. As Esther and Roberto, they said, communities, we cannot undermine them because they have also the solutions. They have some ideas how they want to improve their livelihood. They have some solutions. So we need to provide them with a framework to unlock their potentials, or to unleash their potential, so that they can contribute toward finding solutions finding solutions to the issues affecting them. For the health issues, we have privileged to have a community health workers. We have so many associations. So when you can identify those communities, when you enter in the community, in a place, and bring them closer and start working with them and putting them at the center, at the driver's seat. As I said, nothing for us without us. If you can tell them, like, there is nothing we can do without you. You are sitting at the driver's seat to drive this process and to provide your input, your insight. That's the only way you can unlock their potentials, and they will contribute, and you can just provide the framework to work with them.
Wonderful, thank you. Roberto, I'm going to circle back to you. Something that you mentioned that is near and dear to my heart is capacity building at the local level. Of course, a lot of my work was in technology, but I would love to talk to you a little bit about how you are working to build the capacity of your local level partners, as well as the government, because they are a key local partner as well. So I would love to hear a little bit more about that.
Yes, for sure. So the work of the Hunger Project Mexico focused on transforming the structures that create conditions of inequality, which perpetuate the structural problems previously mentioned. So at the Hunger Project Mexico, we firmly believe that these structures limit the existence of self-reliance communities, those in which community members have the confidence, capacity, and skills to act as agents of their own development at the local level. From our perspective, as a global organization and specific in the Mexico, efforts that focus on processes, projects, or initiatives with an assistance-based approach only address immediate situation or effects, but fail to resolve the root causes of hunger, malnutrition, poverty, and another structural challenge such as inequality, discrimination, and racism. However, we believe this doesn't prevent the people who inhabit and traverse these territories from becoming agents of local development. From the Hunger Project Mexico, communities have the capacity to be central actors in their own development. This phase requires each person to undergo their own empowerment process to break free from resignations. The perception that their circumstance and environment cannot change, and instead recognize it themselves as rights holders, mobilizing their communities to achieve a vision they create collectively, grounded in their worldview and based on human dignity and full exercise of their human rights, you know. So we work to mobilize and develop the leadership capacities in communities so that individual transition from being passive recipients of support to becoming proactive actors who build in a sharing understanding of why it is essential to work together to address their communities and municipality needs. So I know our time for participation is limited, so I will focus it on one of projects which we implemented in 3 states of Republic in Mexico, Yucatan. Those are Yucatan, Chiapas, and Oaxaca. So these projects operate in context of poverty, high marginalization, and rural and indigenous communities. So our project is called the Municipal School for Community-Led Development with Gender Focused. It is a powerful training processes aimed at creating an unstoppable group of active citizens who promote self-reliance in their communities by strengthening organization capacities, at the active participation and dialogue with local government. This school strongly contributes to our community-led development model around the world, but specific in Mexico, which aims to promote citizen and political participation, particularly among rural and indigenous women who all are already taking action through grassroots organization. The school providing a space for connection and intensive 3 months training focused on 3 approaches with human rights, gender inequality, and civic participation. It is designed for grassroots community organizations that are active in their territories, most of them in condition of poverty or vulnerability. This organization consists of community members working on issues such as water, participation, gender, health, education, financial inclusion, food security, democracy, and citizen, among others. So after these 3 intensive months of trainings, the organization developed as a citizen agenda for local development. This agenda outlines their thematic and community priorities, which they address collectively with local government. So the truly interesting part is not just the creation of the agendas, but the power these documents or tools give to women, particularly indigenous and rural women, or those living in poverty. These agendas strengthen the leadership so that women can speak up For many women in rural and indigenous communities in Mexico, the ability to speak at all is a significant step forward. So the citizen agenda become a tool of power that gathers the information and priorities they have chosen to include. So the Hunger Project Mexico works to create national and international spaces for women-led organizations to present their agenda. So I would like to share 3 emblematic cases derivates from these methodology processes. The first one is about of Nereida, my incredible colleague. Is an indigenous woman from Oaxaca, a municipality with high levels of poverty and marginalizations. When she began the municipal school, she was very quiet and hesitant to speak, and I doubt she will finish the process. But my commitment to her and her organization, which advocates for indigenous women's rights and the prevention of violence against indigenous women, was to ensure her priorities were included in a citizen agenda. So in October, during the International Summit on Community-Led Development, an event organized by the Hunger Project Mexico, with over 300 participants, including investors, organizations, government, and the UN, Nereida stood in front more than 200 people to present her agenda. The second one is Irene. Is an indigenous woman from Yucatan who participated in both projects, the municipal school and our social and solidarity economic school. When we first met her, she spoke little Spanish because she's an indigenous woman and was dedicated the household and core work. 2 years after joining our training processes, she is now local authority in her municipality, a remarkable and unstoppable leader. And the last case is about our girls and adolescents advocating for their future. Our project, they decided about their bodies, communities, and territories. In Spanish is Ellas Deciden, is they decide. Works to prevent child marriage by fostering autonomy and leadership among girls. So this year, in 2024, during the UN Commission of the Status of Women, CSW, a group of girls created a video and text to present their priorities from the rural indigenous municipality in Oaxaca to government officials, UN representative, actors, investors, and organizations from around the world. So finally, when I'm thinking about the question posed to me in this panel, I cannot help but reflect that this is not about me. This is not about the Hunger Project Mexico. It's not about it's not about this organization achieving this accomplishment. It's about the communities and the women. They are the ones doing the work. The Hunger Project Mexico simply provides some resources, but everything else comes from the community and the woman. That is when we truly fulfill our mission.
Thank you, Roberto. I appreciate the inspiring stories as well. It brings it to life. I'd like to turn to Esther for the next question. And Esther, this is kind of a two-parter because there's a great question in the Q&A. And it relates to the tension of local, national, global alliances and partnerships and scale. And here you sit in Saudi Arabia. And so one of the questions is how do you elevate the voice and agency of local communities while maintaining those valuable partnerships at the national, regional, and global level? And then also the tension of scaling and taking local projects and scaling and how that's managed. All three of you belong to international NGOs. So that local, national, global tension exists. But Esther, I'd like you to jump in and kind of talk a little bit about how you manage that.
Yeah, wonderful. And yes, and it's again the ability to appreciate that whatever is discussed at the international level impacts the decisions that are made at the regional level and impact the decisions that are made at the local level, at the national level in our countries, and also impact at the local level. So let's talk about the Sustainable Development Goals. This year we are calling it the year of the 3 COPs, because we've just finished with the COP on biodiversity that happened in Cali in Colombia, that was talking about the issues of biodiversity. If you think about the global world, we are told that 60% of the biodiversity that is maintained today is maintained by the local people. But you come to this kind of events, you do not find grassroots people, indigenous people that are conserving this biodiversity. You come here and you're hearing that the 1% of our people that are conserving the land and are leaving the degraded land are also the people that actually are living the worst poverty. While the majority of the land, today we were told over 80% is owned by 10% of the population in the world. And all of us are now haggling in the small space. So what does this mean? So any agreement that is made in this global level, the local community must be able to understand and influence what is being discussed. So for example, the Stand for Halal campaign here in Riyadh has about 25 grassroots women. Today we had the woman from Bangladesh sharing a story of how, because in Bangladesh, you can only get land if you have a landless certificate, if you can show you are landless. And in the last 1 year, they've been able to get 400 women with landless certificate because they were able to meet their minister of land and a minister of gender in the Commission for Women, Status of Women in New York. They now have a partnership where these 400 women are going, who can show they are landless because they have the certificates, they now are going to be given the community land. So the fact that in our communities, in our countries, we are not able to speak with politicians, but when we get out here, we are able to talk to them in the same room. The second thing, when a woman can go and say, you know, the SDG 1 means this, the SDG 2 means this, to a local authority, they are able to listen to them. And when they collect the data on what is happening to them, they are able to influence. Last week, I was in Senegal, and we are talking about in this COP about land degradation. And we were able to see how women who are living the issues of extractive industry have been able to talk to the government because they've understood that the COPs are talking about land degradation, but also how to get land neutral degradation so that the land is no longer getting degraded. And they've been able to bring their lived indigenous women to negotiate with the companies that have been given land by the government of Senegal. And what they are now doing is accounting all the acres of the land and having the government to enforce the global agreed commitments to rehabilitate land that has gone through extraction industry. And they've agreed that this land will be given to grassroots women. So what does that mean? The agreement at this level, the women have come to these spaces, they've understood this agreement and what the global agreements have been agreed upon. They are going to their community, they are taking data and they are giving it back to their national government, and their national government is implementing the laws based on this global framework. So all these things are interconnected, but the missing gap has always been us as professionals talking on behalf of the women and thinking, because there's so much English here, there is so much French here, that the women from the local community cannot understand, but they do understand it. Their stories are so impactful, and they are able to tell the government the realities of the situation on the ground. But again, I want to say this, because this is the assumption I still find so much that is not right, is that there is a thinking that women can continue to volunteer, to organize themselves, to collect the data without pushing the resources in the hands of the women to do this. And I think we need to close this. We need to be able to support women to organize themselves, to collect the data, to analyze the data, and be able to support them to meet with their political leaders in the capitals, but also to come to Riyadh so that they can speak to the chair of the CBD. We are here in Saudi Arabia. Saudi Arabia is chairing the Commission on Status of Women in New York in March. And so today we were telling them, if you are actually chairing the Commission on Status of Women, and we were like 25 women, that you must be able to show from here how you're going to chair the CSW. So when you bring this reality, then you're able to influence the decisions that they make.
I love it, Esther. Thank you so much. That's fantastic. We're going to run out of time, but Freddy, I wanted to circle back with you with a specific before we kind of close with a lightning round. You talked in your elements about data, and others have talked about data as well. VillageReach has an initiative called Community Insights to Action. Can you please share a little bit about that effort around how you're bringing community and data and process? Thank you.
Yeah, for the past 24 years, next year is going to be a 25th anniversary of VillageReach. We have learned how important to put the community at the center, and how to make the community or the underreached part and parcel of the programs. The reason why VillageReach has developed a framework or an approach that we call community insight to action. We call it in short CITA, community insight to action, which aims to drive a systems level change by routinely capturing, analyzing, and integrating insights from underreached a community into primary healthcare systems. Our goal is that this framework of community insight to action will provide a template for VillageReach, but also for the government, for other partners within the healthcare systems across Africa to consider a community challenges, needs, and preference to center them in the design, delivery, and evaluation to drive innovation in healthcare service. If I can give a very concrete example why this framework of community insight to action is very important. In Africa, there are over 615 million of people who are not accessing primary healthcare services. this represents pretty much like 52% of the Africa's population. And we have seen inequities in accessing primary healthcare because the one-size-fits-all health systems does not address the needs and the preference of the communities. So through this framework of community insight to action, we were able, in the countries where we work, in Mozambique, for instance, to collect voices of community members, especially mothers and parents, about the concerns they have about immunizations. What preventing them to take their children at the health facility to get immunized. In Malawi, in DRC, we do the same exercise. DRC, for instance, is one of the countries in the world to have the highest number of children who have never received a single dose of vaccines. The children we call a zero dose. And most of those children live in the underreached areas. So we have to consult those communities. We have to consult mothers and community members to find out what are the barriers. Then they explain their concerns, their challenges. Some of the concerns were, for instance, when the health workers, they go to the community for immunization service during the day, parents are not there. Mothers, they are not there to get their children vaccinated because they have to go to farming or to the market for their livelihood. So when we consulted them to collect their voices, their needs, they say, well, if the health workers can come after hours, when we are back from our business or for farmings or markets, or if they can come on weekends or after Sunday after church service, our children can get vaccinated. So we start working with those communities and the health workers to tailor the health services based on the need and preference of the communities. So eventually, we were able to, in one of the provinces in DRC, from March this year up to October, we were able to vaccinate over 27,000 of children. Whom should not we consult the communities? Should not we tailor the health services based on their needs? Those children will not be vaccinated. With all the consequences, the children who are not vaccinated are exposed to all sorts of vaccine preventable diseases. Just to give you an example, one child contaminated by polio can contaminate up to 200 children. And a child who is affected by polio will not play sport, and the parent will have to spend a lot of resources. So those are some of the results we have seen using the community insight to action in the countries where we work. Maybe I can stop there.
Wonderful, thank you. We're going to be wrapping up here, and I would love to just go around and have folks spend a minute or two, no more, on kind of what parting recommendation, what key takeaways folks should have when it comes to incorporating and making community center of their work. Roberto, we'll start with you.
Yes, in 2 minutes. It's a big
Less fun.
It's a big challenge.
Yeah, there you go. I challenge you.
So in the Hunger Project, elevating the voices of people living with hunger and poverty is key to creating a world without hunger. So we do it throughout our work around the world and have seen the power of collective voices and created change. So we, as the people sitting in global spaces like a global Washington, or the Global Conversations conference in the United Nations or something like that, should be prepared to make a space for these individuals and create opportunities for them to share their experience and their ideas. So I'm think that the most important is about how we can open the spaces, not for us, because it doesn't mean for us. It's about the realities when the people put in the tables with decision makers in the global scenario, regional scenario, or national scenario. Those spaces are gonna be a powerful spaces because the realities are presented in this conversation.
Thank you. Freddie, I'm going around in my circle. Freddie, you're next.
Yeah, so I would say VillageReach is focused on integrating community insight to action into our work because we believe in bringing community insight into solutions and building responsive health systems to do away with the one-size-fits-all healthcare system we are seeing currently in many places in Africa. Thank you.
Thank you. Esther, close us out.
Well, yes, that the solutions that are led by women lead us to sustainable development. That our world, we are struggling how to sustain the lives on Earth. And if we want to have sustainable development and gender equality, first, be able to surface, appreciate, acknowledge, and resource community solutions and their capacities. Secondly, I know we are talking about diverse issues that I would want to recommend that all of us look at how securing women's land rights is preconditional to closing the gender inequality that we have and to sustainable development, considering that everything that we do live on land. We are living and sitting on land. And that unless we have been able to conserve the biodiversity, the resource that we call the land, everything else is going to collapse on us. And we've been told the biggest fight is no longer going to be on anything. It's going to be on grappling for the little land resource that we do have. That land is, and securing women's land rights is preconditional to food security, is preconditional for us achieving good health and nutritious communities, is preconditional for us to having sustainable development and globally, and that the women are at the center of that. And land is a emotive issue. It is not easy, but we have to deal with it because it's necessary for indigenous people, for the rural people, for people living in urban centers. And appreciate to be here.
Thank you all so much. I really enjoyed our talk. I really enjoyed, learning that it's just not about listening to our communities and incorporating their views, but it's about putting our trust and our resources in those communities. And then surrounding them with the support, the capacity building, amplifying their voices, and supporting their process and data. But it is about putting the resources in the community and letting them own and drive the sustainable solution. So I appreciate those voices from you all. I appreciate that it's Giving Tuesday, and I've gotten emails from each one of your organizations today to celebrate and give. I will do so on your behalf today. Please, others that have joined us, thank you so much for joining. Please engage Freddy, Roberto, and Esther on LinkedIn as well as on Whova, and then connect with other goal makers also on Whova and tomorrow in person. I want to thank everyone for joining, and on to the closing plenary. Thank you.